Hi everyone, my name is Sydney ASMR, and today we are going to be doing a quiz on a broad scope of topics. The topics include end-of-life care, prostate cancer, breast cancer, ovarian cancer, really light-hearted subjects. And some of the topics are a bit advanced, and I think that is the point of this video. I believe what will make this video sleepy and help you become sleepy is the fact that the information is a little bit difficult, a little bit advanced, and maybe just a little bit boring. Yeah, boring. And some of this information might actually end up saving your life, or maybe your mom's life, or your dad's life, or your neighbor's life. Maybe. And I feel like it's also important for me to study this information because I'm being tested on it in, about 11 hours in the morning tomorrow. So, yeah. We're gonna learn a little bit, get a little bit sleepy, and have a fun time. Alright, so question number one. The major difference between benign and malignant tumors is that malignant tumors A. Grow at a faster rate. B. Cause death, whereas benign tumors do not. C. Invade and metastasize. Or D. Are often encapsulated. Give you a few seconds to find your answer. Alright, the correct answer is invade and metastasize. So the major difference between the two is that malignant has the capability of growing, potentially going to other organs. As where benign, it does not do that. It stays in one section. Alright, next, number 2. A medical team is conducting human immunodeficiency virus, which is HIV, screening in a community. Which finding would indicate a positive diagnosis for HIV infection? Select all that apply. Alright, I will read the answers. A. A positive tuberculin test. B. A history of intercourse with an HIV positive woman or man. C. A positive enzyme immunoassay, which is an EIA test. A positive Western blot test. Or E. A history of fever, diarrhea, candidiasis, I always forget how to pronounce that, or weight loss. I will give you a few seconds. Alright, the correct answer would be a positive Western blot test and a positive EIA test. Those are the only tests that can be diagnostic for HIV. It's not screening, it's diagnostic. Number 3. The most important method for identifying the presence of infection in a neutropenic patient is frequent temperature monitoring white blood cell count, routine blood and sputum cultures, or assessing for redness and swelling. Give you a few seconds. The correct answer is A. Frequent temperature monitoring. A neutropenic patient is someone who has low white blood cells. Therefore, their immune system, non-existent. It's not very good. And out of all of these options, the best method for identifying a presence of an infection, especially early on, would be temperature monitoring. Number 4, the nurse uses many precautions during IV administration of vesicant chemotherapeutic agents, primarily to prevent A. extravasation, B. catheter occlusion, C. anaphylactic shock, and D. septicemia. Give you a few seconds. The correct answer is A. When we're giving a chemotherapeutic agent, you are basically killing cells. That's what it is. You're killing everything in there in hopes of killing the cancer cells. And if it leaks into your skin, what's going to happen? It's going to cause necrotic tissue. We want to make sure that it stays in the blood vessels and does the job it's supposed to do, and not cause tissue to die. Number 5. A patient with cancer-related pain and a history of opioid abuse complains of breakthrough pain 2 hours before the next dose of sustained-release morphine sulfate is due. Which action should the nurse take? A. Administer the prescribed PR and immediate action morphine. B. Suggest the use of alternative therapies such as heat or cold. C. Utilize distraction by talking about things the patient enjoys. Or D. Consult with a doctor about increasing the MS content dose. I will give you a few seconds. The answer is A. If someone is having breakthrough pain, which is a fast onset, very, very, very painful pain, we want to give them medication, morphine. It needs to be fast acting and short acting so that it can make sure that you're not in extreme pain during your breakthrough pain. It doesn't matter if they have a history of opioid abuse. Pain is a very real thing when it comes to cancer, and we have to address it. When the nurse visits a hospice patient, the patient has a respiratory rate of 8 breaths per minute and complains of severe pain. Which action is best for the nurse to take? A. Inform the patient that increasing the morphine will cause the respiratory drive to fall. B. Titrate the prescribed morphine dose upward until the patient indicates adequate pain relief. C. Tell the patient that additional morphine can be administered when the respirations are 12 breaths per minute. Or D. Administer a non-opioid analgesic, such as a non-steroidal anti-inflammatory drug, to improve patient pain control. I will give you a few seconds. The answer is, I'm actually trying to remember. So since they are in a hospice and they're in a lot of pain, it's not a bad thing if we give them more morphine. You're not supposed to give morphine if their breaths are really low, and 8 breaths per minute is extremely low. Generally, we would hold and address the fact that the respirations are low, but since they're in hospice, I believe it's B. Yeah. Yes. The goal of opioid use in terminally ill patients is effective pain relief regardless of adverse effects such as respiratory depression. Number 7. In the care of clients with pain and discomfort, which task is most appropriate to delegate to unlicensed assistive personnel? Basically, people who are techs or they're not an LPN or a nurse with a bachelor's or something like that. They are unlicensed. So we have A, monitoring the client for signs of discomfort while ambulating. B, evaluating relief after applying a cold compress. C, coaching the client to deep breathe during painful procedures. And D, assisting the client with the preparation of a sitz bath. All right. The answer is D. Number 8. Ocho. During an end-of-life client care situation, which of the following actions are important for the nurse to include in the plan? Select all that apply. A. Observe all cultural and religious practices that the client expresses as part of the plan. B. Announce the time of death when it occurs. C. Allow the client and family to express feelings about the dying process. D. Ensure that the client does not have to watch the monitor during the dying process. And E. Educate about the stages of dying with the client. Good luck with that. Take your time. You can pause it if you want. The answers are: observe all cultural and religious practices, of course. Allow the client and family to express feelings about the dying process. And ensure that the client does not have to watch the monitor during the dying process. The reason why B is incorrect is that technically a nurse, they aren't allowed to announce the time of death. That is the job of the physician. And E, the reason why that's not correct is because if you have a patient that is very close to dying, we don't really need to explain all the stages of dying at that time. If a person is dying, they should devote their last couple of hours, whatever that amount of time they have, to the things that they want to do, be with their family, whatever it may be. And hopefully at this point in the process, they may already know and have already been educated about it. So, number 9. A 62-year-old patient complains to the nurse that mammograms are painful and a source of radiation exposure. She says she does breast self-examinations monthly and asked whether it is necessary to have an annual mammogram. The nurse's best response to the patient is: A. Unless you find a lump while examining your breasts, a mammogram every 2 years is recommended after age 60. B. An ultrasound examination of the breast, which is not painful or a source of radiation, can be substituted for a mammogram. Letter C. If your mammogram was painful, it is especially important that you have it done annually. Or letter D. Because of your age, it is even more important for you to have annual mammograms. The correct answer is letter D. So the reason why D is correct is because I think it's once you turn age 50, you should be having it every year. Yes, there is a small amount of radiation that you're exposed to with a mammogram, but it's so little you do not have to worry about it, okay? Don't stress about that. Alright, the nurse understands that a patient with HIV starts to develop immune problems when their CD4 count A drops below 500, B is greater than 500, C drops below 200, or D falls between 800 to 1200. The correct answer is A, drops below 500. Now, let's take this time for a little education. HIV is really bad, alright? But the thing is, we are at a point in the world timeline where HIV can be treated. Not necessarily curable, but you can still live a long, happy life as long as you catch it early. Now, you can get HIV by being breastfed by your mom who has HIV, by spreading needles, or through intercourse. There's no shame There's nothing to be ashamed of, but communication with your partner is very important. And it's extremely important to get tested after you have sexual relations. Because if HIV goes untreated and unnoticed, for the first few weeks, you're hanging out, it's whatever, you're asymptomatic, living life, and then you start to exhibit flu or cold-like symptoms. A lot of people will treat this with over-the-counter medications and keep on moving, keep on living. You know, they aren't scared. But, as time progresses, your CD4 count will start to lower, and then lower, and then lower some more. And eventually your immune system, it's not so good, not so good. And when it drops below 200, that's when you have AIDS. And when it gets to that point, it's pretty bad. It's very, very unfortunate. So, I challenge you and encourage you to get tested. Don't be scared. It's very safe and no harm, no foul. Number 11. The nurse obtains the following assessment about a client who has had a transurethral resection of the prostate, otherwise known as TURP, and has continuous bladder irrigation, which finding indicates the most immediate need for nursing intervention. A. The client reports painful bladder spasms. B. The catheter is taped to the client's thigh. C. The client states that he feels a continuous urge to void. Or D. The catheter drainage is light pink with occasional clots. Choose your answer. The answer is A. So, TURP, if you have a large prostate, benign prostate hyperplasia, and it's when you remove a little bit of the inside of the prostate. It's a scary image. It's scary. It's alarming to look at. And afterwards, you have to have a catheter where you irrigate the bladder. And being taped to the thigh, that's fine. We expect light pink drainage. There will be a little bit of blood. Now, if it's dark red, that's a no-no, okay? But they should not be experiencing painful bladder spasms. It might be occluded or a blockage or something like that. That means you need to stop the irrigation and reassess. Number 12. During an intravenous push administration of doxorubicin, a chemotherapeutic agent, I don't know if I pronounced that correctly, but it's okay, peripherally into the client's left forearm, the nurse becomes unable to obtain a blood return. The client reports no discomfort at the site and no swelling is noted. What is the appropriate action by the nurse? A. Since the client has no complaint of pain, continue the administration. B. Remove the IV catheter and restart it at another site. C. Flush the IV saline with saline to ensure no extravasation has occurred. And D. Reposition the needle in hopes of obtaining a blood return. The answer is C. If you remember, we talked about extravasation. I don't know if I'm saying that correctly, but I know what it is, okay? That's all that matters. And again, we don't want that chemotherapeutic agent, this doxorubicin, to get into my skin, okay? I want my skin to be alive, okay? I don't want necrotic tissue. I don't want it to die. I want it to go where the cancer is so that it can kill the cancer. So we flush it with saline to make sure that it hasn't occurred. Alright. Number 13. In application of the principles of pain treatment, what is the first consideration? A multidisciplinary approach is needed. B. Drug side effects must be prevented and managed. C. Treatment is based on client goals. D. Client's perception of pain must be accepted. Accepted. Pain. Disciplinary. The answer is D. It's really important to trust your patient and trust when they say that their pain is a 10 out of 10. We skipped a question because it wasn't really a question. It was some advice from my tutor. But number 15, the nurse is presenting to a community education program related to cancer prevention. Based on current cancer death rates, the nurse stresses that the most important preventative action for both men and women is A. Regular examination of reproductive organs. B. Routine colonoscopies. C. Protection from the ultraviolet light. Or D. Smoking cessation. The answer is D. Stop smoking, and your chances of cancer will decrease, my friend. Number 16. A 55-year-old man with a history of prostate cancer in his family asks the nurse what he can do to decrease the risk of prostate cancer. What should the nurse teach him about prostate cancer risks? A. Adding fresh fruits and vegetables in place of high-fat foods in the diet may lower the risk of prostate cancer. B. Treatment of any enlargement of the prostate gland will help to prevent prostate cancer. C. Nothing can decrease the risk because prostate cancer is primarily a disease of aging. And D. Using a natural herb, saw palmetto, has been found to be an effective protection against prostate cancer. Take your time and find your answer, and I will tell you if you're right or wrong. Right or wrong. Are you right? Are you wrong? Are you right? Are you wrong? The answer is A. One of the only things that you can do to prevent prostate cancer is just eat healthier, man. Low fat, eat some fruits and veggies, and live life large. Alright, number 17. A patient who uses a fentanyl patch for chronic cancer pain complains to the nurse of the rapid onset of pain at a level 9 out of a 10 scale, and requests something for pain that will work quickly. The nurse will document this as A. Somatic pain. B. Neuropathic pain. C. Referred pain. And D. Breakthrough pain. I had my cursor over the answer. It's breakthrough pain. It's number 18. When assessing a patient for breast cancer risk, the nurse considers that the patient has a significant family history of breast cancer if she has A. Sister who died from ovarian cancer at age 56. B. A cousin who was diagnosed with breast cancer at age 38. C. A grandmama who died from breast cancer at age 72. Or D. A mother who was diagnosed with breast cancer at age 42. Take your time to find the answer. Take your time to find the answer. The answer is D. Having a very close relative, like from first generation, like your mom or I think it's just your mom, your parents. That's a significant family history. Number 19. Which client can be appropriately assigned to an LPN, that's an associate's degree, who will function under the supervision of an RN or team leader? Select all that apply. A. Client who reports abdominal pain after being kicked, punched, and beaten. B. Client who underwent a toe amputation and has diabetic neuropathic pain. C. Client with a late cast who needs neurocirc checks and as needed PRN hydrocodone. D. Client who needs post-operative teaching about the patient-controlled analgesia pump. Or E. Client with terminal cancer and severe pain who is refusing medication. So, what will an LPN do and what will an RN do? You're going to pick the things that an LPN would do, okay? So, have at it. Look at the answers. Think about it. Whatever. Okay. What clients can be appropriately assigned to an LPN? It would not be A. That's a pretty serious thing. We're going to give that to an RN. B, yes, we would do B. Toe amputation, it's alright, it's all good. Diabetic neuropathic pain, it's pretty common. We can let them do that. C, yeah, that's fine. You're going in, doing what needs to be done, get out. D, we will not let them do that. That is an education that needs to be done by an RN. And E, a person who has terminal cancer, who has severe pain and refusing medication. That could be a number of things. They could be saying, hey, I'm ready to die now, or I'm so depressed I'd rather be in pain. That's a topic that might need to be done with an RN rather than an LPN. Number 20. Isn't this lighthearted, guys? Isn't this fun? Aren't the questions just making you feel alive inside? Number 20. What is the most common screening intervention for detecting BPH, benign prostatic hyperplasia, in men over age 50? So this is a screening intervention. A. Cystoscopy. B. PSA level. C. Digital rectal examination. Very fun. D. And urinalysis. Alright. The answer is C. Yeah. I'm sure everyone loves to get digital rectal examinations. They're super fun. Alright, 21. The nurse is caring for a client admitted with, oh my goodness gracious, cytomegalovirus and is HIV positive. The nurse notes purplish lesions in the trunk and back during the initial assessment. What accompanying condition are these spots related to? A. Scabies. B. Tuberculosis. C. Atopic dermatitis. Or D. Kaposi sarcoma. Give me a little time to look at the answers. The answer is D. And if you're already starting to get those purplish lesions on your back, you probably have AIDS at this point. Number 22. After chemotherapy, a client is being closely monitored for tumor lysis syndrome. Which laboratory result requires particular attention? A. Hematocrit levels. B. Electrolyte levels. C. Platelet counts. Or D. Hemoglobin levels. Hematocrit, electrolyte, platelet, hemoglobin, electrolyte, hematocrit, platelet. The answer is electrolyte levels. Tumor lysis syndrome can result in severe electrolyte imbalances and potential kidney failure. Usually look at potassium, phosphorus, and calcium issues. The other laboratory results are important to monitor to identify general chemotherapy side effects, but not so much to do with tumor lysis syndrome. Number 23. The husband and daughter of a Hispanic woman dying from pancreatic cancer refused to consider using hospice care. What is the first thing the nurse should do? A. Ask them how they will care for the client without hospice care. B. Accept their decision because they are Hispanic and prefer to care for their own family members. C. Talk directly to the client and family to see if the nurse can change their minds. D. Assess their understanding of what hospice care services really are. Alright, take your time. Take your time. The answer is D. The reason why this is correct is that, hey, if you don't want to do hospice care, that's fine. But let me just make sure that you know what hospice care really is. So, yes, you could put your Hispanic mom in a building with a hospice and she can stay there 24/7. But hospice care can also be at home. You can have at-home hospice care. A nurse can come and they can make sure that you are having a perfect amount of morphine, whatever your pain medication is. They can assess you. They have a bachelor's degree. They know what they're doing. They're familiar with this. They can set up IVs. They are trained to know what to do in a lot of different situations. So, hey, if the family doesn't want that, if they want to take care of their mom on their own, that's perfectly okay. It's just important that they know what their options are and to be educated. 24. The human immunodeficiency virus, HIV, infected patient is taught health promotion activities, including good nutrition, avoiding alcohol, tobacco, drug use, and exposure to infectious agents, keeping up to date with vaccines, getting adequate rest, and stress management. The nurse knows that the rationale behind these interventions is best described as A. Enabling an increase in self-care activities. B. Delaying disease progression. C. Preventing disease transmission. Or D. Helping to cure the HIV infection. The answer is delaying disease progression. Can't cure it, unfortunately. They already have it, so it's not really preventing. Delaying is the most correct answer. 25. A client transferred to the surgical unit after suprapubic prostatectomy has a 3-way urinary catheter. The client reports having pain in the lower abdomen. What is the priority nursing intervention? A. Increase the irrigation flow rate. B. Chart the observation in the medical record. C. Report the finding to the healthcare provider. Or D. Assess the catheter for patency, drainage type, and drainage amount. What do you think the answer is? Look at the answers and tell me. Lock your answer in. Are you smart enough to answer and get the correct answer? Will you win $1 million today on my guest show? The answer is D. Assess the catheter for patency, drainage type, and drainage amount. If they're having pain, there could be an occlusion, and we do not want that. How did you do? In the comments, let me know. Also, I just want to let you know that I do take these subjects very seriously. I'm just kind of doing it in a lighthearted way for the sake of this video. And I do enjoy teaching a little bit of teaching. Not a lot of teaching, but a little bit of teaching. I think it's fun. I like to raise awareness about certain things that could potentially save your life. You know, it's kind of crazy. Thank you for watching this video. I hope that it made you a little bit sleepy. And if not, maybe you just learned a few things or you just had a good time. Heck yeah. I hope that you sleep well, stay safe, and thank you so much for watching. Please subscribe, comment, and press that like button. That was kind of cringe. Alright, have a good night.